Eric Hammer here, registered physiotherapist. Today I'd like to talk about the influence of thoracic extension or mid-back extension in the treatment of shoulder dysfunction. But before I continue, please hit that subscribe button below. So essentially the mid-back or the thoracic spine, it has a major influence in the ability to raise up the arm and impact lateral rotation of the scapula, right? So basically our ability to bring and go into shoulder flexion. So what ends up happening, and particularly during these times where people are sitting a lot, right? So in front of the computer, looking at phones, etc., we can develop what's called kyphosis, which is essentially a lot of rounding or flexion in this mid-back area. Now, when we're in this kyphotic state, there's a few things that happen there. One, it makes it more challenging to do this lateral rotation, right? That's going to take place in our kind of in the shoulder blade area here. It limits that. And also, we get more posterior tipping, it's called, of the scapula. Basically, those shoulders being forward, which again will minimize, right, our ability to go up into this position. And from a functional perspective, this can impact our ability to reach for things, go up into cupboards, these type of things. And again, you would see this along with certain shoulder dysfunction. So when we get tight through here, right, and we combine that with this kyphotic state, it's going to do, it's really going to create a lot of limitations in terms of our ability, right, to go into this extended position. So a couple of things I wanted to show just in terms of some self-mobilization techniques for the thoracic spine. So one is essentially reproducing this motion here. So the idea from the back here, so if I'm in this position here, right, I'm going to actually try and sit up nice and tall. I'm going to do a little bit of a look up, right, and then I'm just going to repeat extensions back. And the key is, right, is to try to, it's almost as though you're trying to set those shoulder blades back first and look up slightly before you go into that extended position, and you're actually trying to reach back. Some people also find it beneficial to actually interlace the fingers, right, and then extend back, and that will help to bias more thoracic extension. Okay. Another great exercise that you can try, especially if you're not limited in external rotation at all of the shoulder, is a self-mobilization against the wall. So the idea here is you would have your legs slightly bent, right? You're going to try and bring your arms flat up against the wall here, and then you can either hold that position or you can actually try and raise up the arms to try to actually mobilize, as I mentioned, that thoracic spine. Now, as we get more movement, right, through the thoracic spine, should find, hey, all of a sudden, yeah, I can get a little bit more flexion through the shoulder. Again, there's lots of different factors that impact our ability to go into shoulder flexion. So one is just in the actual glenohumeral joint, our ability to, depending on the scapula, if there's any sort of muscle imbalances in terms of the actual scapular movement, and then finally the thoracic spine. So all three, right, can impact our ability to raise up the arms here. If you have any questions or concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure that this exercise is appropriate for you. Have a great day, and thanks again for watching. Take care. Bye.